Hi, and welcome to Healing Peak Regenerative Medicine's Longevity Channel. And today we're going to talk about knee pain. It's something that I see a lot, and I just kind of want to talk about whether or not you need a knee replacement, or what are your options for knee pain. How do I treat it? How is it different than conventional medicine? And there are so many options that I see underutilized for knee pain, ultimately ending up in many joint replacement surgeries that may have not been totally necessary. And part of that is due to arthritis and the effects of arthritis and not being well treated with diet and lifestyle changes that can make a huge impact on whether or not that person is going to need surgery. And it's always a goal to prevent surgery or to stave it off as long as possible. And with knee pain, and I'm going to primarily focus on arthritis today because that's the thing that I see coming up the most. And when they do imaging of your knee, they're going to say, oh, that's like really what they're looking for. They're looking for some other structures in there as well, as far as like, issues with your MCL or meniscus, that type of thing. And that's more of an acute injury that has happened, or maybe, you had an acute injury at one point and didn't treat it, and then, it starts to bother you later. And then they'll go in there and look and say, okay, what happened here? What's going on? Do you have things that are floating around that joint that we need to take out? Do we need to clean out the knee? And what cleaning out the knee means is they don't really know, and they're hoping that if they go in there and clean it out, that all your pain will resolve. And they're probably going to give you a 50-50, success rate on that, like 50% maybe it'll work, maybe it won't. It's a pretty low success rate, or a big question mark on whether or not a surgery is going to work. And typically, if you are going to get a surgery, I personally, and I think most of my patients are going to want more than that, as far as like saying whether or not this is really going to work for you. And if it's not, then why not explore all your other options? And so what those are trigger point injections, prolotherapy, and PRP. And those are 3 different types of injection therapies. They are not super painful. They should not be super painful. I've heard a lot of stories about how PRP is really painful, and when done correctly, and when the patients are screened correctly and the concentration is correct, it really isn't a very painful, injection or recovery period. Occasionally there will be a flare, but it won't last very long. So, and I prep all my patients for that. So anyway, if you have been diagnosed with arthritis and you have knee pain, and the conventional treatment is either to give you a cortisone injection or to recommend that you have a joint replacement, or that maybe you just go to PT and see if that helps. And definitely PT is a good option no matter what, because that's going to help you use exercise to strengthen the right things that have been weakened. The knee is a hinge joint, and so it needs to track, on the same line. And occasionally, once arthritis happens and once instability starts to happen, is it comes off the track and starts to function and create grooves in places where it shouldn't, and that can create pain. And so getting those muscles loosened up, and then some prolotherapy to stabilize those ligaments and tendons, will bring the knee back into the right track so that it will hinge correctly, and then your pain goes away. And that is always first line treatment, making sure that the knee is operating in a functional capacity, because maybe you end up with a knee replacement or thinking that you need one, when in reality you may never need one. And a lot of people have arthritis and don't even know they have it, and because it's not creating pain. And so if your arthritis is not creating pain, or your, we'll say, diminished cartilage or cushioning is not creating pain, then you don't need a surgery, right? So there are people who have no cartilage left in their knees and they don't have pain. Maybe a little stiffness here and there because of, they're 90 years old, of course, right? But if you don't have pain, you don't need surgery. And if you don't have pain, you don't need a joint replacement. And so there's a lot of ways that you can treat that pain before those even become an option at all. cortisone injections, they shut down the immune function of the entire joint, and that leaves you in a really vulnerable state because your body signaling is no longer operating, meaning you no longer will know if your knee is functioning well or not, and if you're overusing it or not. And it also degrades the tissue around the joint that's already being degraded by the other inflammatory things that are going on in there. Prolotherapy is a interarticular, means goes in the joint injection, and that shuts down that chronic inflammatory process. It often feels like a salve for people, a salve being just like a very calming, soothing feeling after those injections, and it often clears up a lot of that arthritic pain. And there is a possibility then at that point we'll need to do platelet-rich plasma to build back up that collagen formation even further, depending on the severity of the arthritis. And if there's no arthritis in the knee, or there's no injury to the inside of the knee, you can also do prolotherapy to strengthen the joints out, the ligaments and joints outside the knee, the MCL and the LCL, and you can do it around the patella, and that is really effective treatment also, and usually used in combination with trigger point injections. You can maintain a healthy, non-painful knee for years and years and years. And what I hear the most is that I had no idea from my patients is that they say, I had no idea these treatments were available to me. I had no idea these treatments existed. If I would have known, I would have never done cortisone injections. If I would have known, maybe I wouldn't have needed surgery. And so I just kind of wanted to talk about that today. Things that you can do at home to see if maybe something, in your behavioral lifestyle could help you would be to eat an anti-inflammatory diet. And that would be, the Whole30 is such a good resource and works for like 90% of people. There's a couple situations where it won't work, but those are, those really should be managed by a physician anyway. And so if the Whole30 is not working for you and you don't feel amazing on it, then, go to your local naturopathic doctor, come see me at Healing Peak Regenerative Medicine. We can get all of that figured out. But in any case, the first thing to try is the Whole30, and I would recommend doing it for 2 to 3 months, not just the 30 days, and seeing if your pain completely resolves, or it resolves by 90%. Often that is the case, and no injections or therapy are needed. And on top of that, I would do PT at the same time to learn about how to use your body correctly, see where your weaknesses and your strengths are, and then start that PT regimen. And if your pain is cleared up, then you're good to go. If it's not, then it's time to, seek out either me or someone else who can do the therapies that I do. And so then the other piece that you can do is, curcumin is a great anti-inflammatory, and a high potency, good quality fish oil is also an excellent way to reduce inflammation. And so those are just a couple of supplements that you can take also for knee pain. And I am happy to see you if trigger point therapy or prolotherapy or PRP are a good solution for your knee pain. I really think, I don't know, I'm going to take a guess here, but 75% of people, and that's probably a fairly conservative estimate, are not needing to get the therapies that they're getting from conventional medicine, such as cortisone injections and surgery, especially not as soon as they need it. I don't think that there's any reason to be getting multiple joint replacements in a lifetime. There's so many other preliminary things that can be done to make sure that if you do end up needing a joint replacement, that it is not done until you are substantially old enough that you will never need another one. And I'm not against joint replacement surgery. I've seen it be very successful for many people, but you don't want to do it if you don't have to. You won't have full function of that knee back at any point, and so after that surgery. And so there's a way, there's many ways to keep that full functioning joint going as long as possible, and maybe never even need joint replacement. If you can, stay on top of these therapies, learn PT, stay on an anti-inflammatory diet, you most likely are going to be good to go for the rest of your life. So I am going to continue to advocate for healing of knee pain. It's so rampant in our society and starts to really need to be addressed by naturopathic care. and naturopathic doctors, as well as very educated physicians in the field of orthopedic medicine. Okay, thanks so much. Have a great weekend.